I'm Insomniac and welcome to my channel. It's lovely to see you again. So when was it? Friday I had the glucose tolerance test. I was told that it would take between 2 to 5 hours depending on where my levels were falling, and if they fall low enough, quickly enough, I could be out sooner, nearer the 2 hour mark than the 5. But for some reason, I think there may have been a staff shortage. What actually happened was they said they'll take all the bloods off to the lab, but none of the results would be back that day. The results would be back sent off to my endocrinologist, and my endocrinologist will have those results on Monday. So they just gave me, they did a baseline blood, and then after that there were 6 more blood tests spaced half an hour apart. All the cannula that went in, that was a little bit painful. I'm usually okay with cannulas, but this needle was a lot thicker. Normally I have the green one, that when they take blood, but because it was like an on tap kind, I think it was pink, so the needle was a lot thicker. And so first of all they went through, can't see it, they went through here, and they couldn't get anything out. And then they tried my good vein, which was this one, and they managed to get some blood out, but only because they had to syringe it out. And then after that they couldn't get anything else. That was just for the baseline bloods. And then after that they had to take the blood from here instead. They managed to get the cannula in and take the bloods from there for the rest of the duration. So yeah, it wasn't actually too bad. There were some lovely people there that I was talking to, pretty much kind of in the same boat, although they're a little further down the line than me, and they were having tests upon treatment or something, see if their treatment was effective, or I'm sure I'll be there at some point too. It was a little bit depressing because they both still felt very rough, and I know one of them was 4 years into treatment. I'm not sure about the other one, but that is kind of depressing, isn't it? Like, you finally find out what's wrong, and then they say, oh, we're going to give you this medicine or that medicine, and then it takes more than 4 years to get the dose right, like, until you can begin to feel better. Or, well, in one of the lady's instances, she wasn't feeling any better. So yeah, I guess I kind of thought, a little naively, that when they find out what's wrong, they'll give me a tablet or two, or an operation and medication, and I'll be on my way and feel, probably about 50% better after, like, within like a few months, and then probably about a year later feel right as rain. So I guess I was a little bit naive about that. But saying that, there have been some people on the support group that I joined that have actually been fine, like 8 weeks after. Some people with like brain pituitary tumours, they have the operation, and quite a few of them after 8 weeks, 12 weeks after they're up and getting put on their meds, they feel better than they felt in years. So I'm hoping I'll be one of those lucky people, and I hope the people I saw yesterday, their luck turns and they start to feel well or better soon. So yeah, so that was that. One thing I was looking a little bit into was the urine osmolality, because what it should be is between 500 and 850, whereas mine, at the last measurement that I know of, not March's results, but prior to, so probably February, it was at 193, and the month before that it was at 154. So it should be between 500 and 850. That is way, way lower. And I was reading that if the urine osmolality is low, that can sometimes mean that you're producing low levels of the ADH, which is the antidiuretic hormone, which is in charge of the kidneys, which tells you sort of like, I think it has something to do with, it tells your body when to pass fluid and things like that and when to dilute it, and it seems that I may be lacking in that with that low level. But I think that's what the water deprivation test is about. I think they test the ADH levels in that, and that's when they give you the, I didn't write it down, vasopressin. Forgive me if I've said that wrong. I will, in the bit where it's subtitled, I'll write the correct spelling for that. So I'll correct it in the subtitles if it needs correcting. But yeah, so low ADH levels can be caused by diabetes insipidus, which, as you know, is what I originally went to my doctor with in the first instance. Like when she referred me to endocrinology, I did say I think I may have diabetes insipidus and Addison's, but sorry. But Addison's probably seemed a little unlikely because although the cortisol level was low in a few of the tests, it wasn't ridiculously low, and there was one that was 440 or something, and for a diagnosis of Addison's, I think it needs to be below 350. So one of the times it was higher than that. So I think, if anything, probably looking at maybe Cushing's disease rather than syndrome, because quite possibly it could be caused by a pituitary tumour. So that would then be Cushing's disease rather than Cushing's syndrome. I think that's the way it works. It's very strange. But yeah, it can also be caused by the low levels of ADH, could be caused by diabetes insipidus, damage to the pituitary gland, or hypothalamus problems, or mental health issues. But I remember she did say to me, with the drinking lots of water and everything, that can sometimes be to do with mental health. But when I read up on it, that's more to do with schizophrenia than anything like bipolar. It's common in schizophrenia. But I haven't ever had that diagnosis. I don't have schizophrenia, I have bipolar. At one point, as I've said before, they were a little bit sort of on the fence. Is it bipolar? Is it schizoaffective disorder? But yeah, they ended up settling on bipolar diagnosis. I can hear somebody outside. So on Monday, I do have to collect my lower dose of Tracidome that the prescribing nurse last week was kind enough to prescribe for me. I haven't got round to collecting that just yet, but we have to go out. I've got there's an appointment or something on Monday, not for me, I think for one of the children. So whilst we're out, I can collect that at the same time. So I'm not too worried about coming off of the Tracidome. I know there's been lots of horror stories about that, and I have read Tracidome in particular can be a very difficult one to come off of. I have successfully come off of it before, tapered it down and come off completely, and I was absolutely fine, didn't really suffer any ill effects from it. I'm just hoping this time around it will be the same, because as he said, the nurse prescriber, rapid cycling could be caused by the Tracidome. So hopefully, if it is that, coming down will help. So I don't think it's caused it, because I've been on the Tracidome for years, but I think maybe it's not helped the situation, say where I've been was triggered over my cat. Like, that was very traumatic for me. I think maybe the antidepressant didn't help with that. Maybe that is, you know, encouraging rapid cycling rather than just my usual, you know, hypomania, mania, then psychosis. But I'm glad the risperidones kept the psychosis at bay, because that's difficult to come back from when I get that sick. So I can't even read this. So I'm going to ask, when I see my endocrinologist on the 26th of May, I am going to ask if I can have my blood results printed off or sent to my doctor, because obviously I want those for myself. So I've got a record of all my bloods. It's just my doctor doesn't always, well, if she hasn't ordered the tests, then what tends to happen is she won't put them up on like the app that I can log into to see test results and things. She won't actually put the results up there. So they'll just be on the doctor's side of things. Like, say if I was to go into hospital and they checked all my past results, they could see it, but there's no way of me seeing those results. And for me, that's important, because I need to know if something's working, if something isn't working, if the levels are going up or down. Just in case it's missed by anybody, at least I can say, oh, that level's done this. And you know, I think we may need to discuss a different treatment or something, you know. So 12th of May, I've got more bloods and an ECG. Those are the ones, ow, ow, ow. Those are the ones that, sorry, dead leg. Those are the ones that the nurse prescriber has ordered. So I'll be having those next Thursday. And that won't take long to come back, because it's not specialised bloods. That will just appear on the app where I can see the results. Probably what we're doing, having it on Thursday. Results shouldn't take any longer than Monday, Tuesday afternoon. So yeah, that should be fine, of the following week, obviously. So what I'm going to do, I think I may skip doing a video this Wednesday, because there won't be many more results or anything. I don't think any, actually, that I'll be able to get, because obviously I don't want to annoy my endocrinologist by keep calling and saying, you know, oh, do you have the results of this? Do you have the results of that? Blah, blah, blah. So I think I'm going to give her a little bit of a break and just wait until my appointment on the 26th of May before getting the rest of that information. So yeah, I think I'll do that. I think that's the best bet, really. You don't want to annoy the person that's going out of their way to find out what's wrong with you, really, you know. So yeah, that's been all I've been up to. Just tests and things. Yeah, I don't think there's anything else that I've got to discuss, other than the fact I did begin taking vitamins, the B vitamin complex vitamins, and also a vitamin D one that has, I think it's got calcium and zinc in it as well. But I've stopped taking those because of the MRI, and I haven't taken them since. So what I might do is start taking them again from tomorrow. And then yeah, I think that'll be it. There was something I was going to say. I need to write down to ask my endocrinologist about the sodium levels, the urine sodium levels, because it's still below 20, and they have been since I've been first tested, which was all the way back in December or November actually, because I was referred to endocrinology in December, so November. And they actually haven't done anything about those levels being low, the sodium level being low. So I am a little concerned about that that's not being taken seriously, because obviously electrolyte imbalances can be quite dangerous. Sorry about that, let me just turn that down. There we go. I'll give them a little call back later. So yeah, I will ask about that because I think that's important to address because I don't want it being forgotten. And it could be contributing to some other of my symptoms, like the slow heart rate. I read that can be caused by an electrical imbalance. So I think I will mention that to her when I see her. So thank you for joining me today. I hope you're all keeping well. And I will see you probably, we'll give next week a miss. And I'll see you back the following Wednesday, which will be, I don't have my dates on me. I am terribly sorry. Let's see. So we'll miss next week. Give you guys a little bit of a break from my chit chatter. And I will see you on, shall we say, go back to Wednesday again. Yeah, Wednesday the 18th of May. Because that's the day I speak to my psychiatrist, and I'll have the bloods and ECG that the nurse prescriber had sent me for, and so we'll have a clearer picture of what they're going to do mental health wise. So I will speak to you on the 18th of May. Please like, comment, subscribe and hit the notification bell if you'd like to be notified when I next do a video. Thank you all for listening, and I will speak to you soon. Take care. Bye.